Hello everyone, I am Dr. Punit Garg, Consultant Pediatrician at Adarsh Hospital, Malad West, Mumbai.
I'm Dr. Aditi Goimawala, also a child specialist from Mumbai.
In today's video, we'll be discussing some important aspects about umbilical cord care in the newborn. Umbilical cord is a normal structure that connects the baby to its mother when the child is in the womb. It helps in the transport of nutrition and oxygenated blood to the baby and removes the waste from the baby.
After the birth of the child, it is cut and clamped. There are no nerves in the cord, so it is painless.
The umbilical cord normally falls off 7 to 15 days after the birth of the baby, and the portion of the umbilicus which remains is called as the umbilical stump. This umbilical stump goes through a series of color changes starting from yellow to green to brown and finally black. The cord clamp may remain in situ till the separation of the cord.
Now let's see how to take care of the stump. First, clean it with cotton or a clean wet cloth dipped in cool boiled water. Do not use alcohol or alcohol wipes or soap for cleaning. Clean with water or a mild soap if soiled with urine or stool. Keep the stump dry by regularly exposing it to air and keeping it open. Avoid soaps, oil, powder, cream, haldi, ghee, cow dung near the stump or navel. Do not use neosporin powder or betadine powder unless advised by a doctor. Sponge baths in earlier days is useful so that the navel does not come under water for a long time. You can bathe if you want, but don't immerse the child in the tub. Loose fitting cotton clothes for your child. Careful with poo and diaper. Fold the nappy down below the umbilicus. Allow it to fall off on its own. No pulling over even if it is hanging by a thread.
Now there are some very important things that all parents must know regarding the umbilical cord and when you should visit your doctor. The first is if there is delayed separation of the cord. That means that the cord has not separated by 3 weeks of life. In this case, the pediatrician would have to rule out certain conditions such as immunodeficiencies, structural abnormalities and infection. The second thing is you should be on the lookout for any signs of infection of the umbilical cord, such as any yellowish pus oozing from the base of the cord, which is foul smelling, any redness or tenderness around the umbilicus, if the baby is crying on touching the stump, or if there are any general signs of infection such as fever, irritability, bloated abdomen, or the child is not taking any feeds. Also, there is a small amount of bleeding which normally occurs when the umbilical cord separates, and this normally dries off and forms a crust. However, if the bleeding is prolonged, if it is continuous, or if there is a large amount of bleed, then you immediately need to show a doctor. In addition to these, there are two important conditions that you need to be aware of.
Umbilical granuloma. It is a moist pink lump of tissue that can form at the baby's navel. Usually, some granulation tissue remains at the base of the stump. It is a healing tissue and it shrinks and heals the area. Exaggeration of this reaction leads to umbilical granuloma. It is usually 3 to 10 mm in size. It is a minor problem that usually looks worse than it is. If it is small, it shrinks with time. Keep the umbilical stump open and it settles in 7 to 10 days if it is not infected. There is no specific treatment for it. Moderately sized granulomas can be treated with common household conditions like applying common salt over it, keeping it for 3 to 4 hours and washing it off. Please do not rub it off as it can cause bleeding. If this is not effective, surgical treatments like cauterization and surgical ligation can be used. Please visit a pediatrician if you see any such swelling, as it needs to be differentiated from adenoma and a polyp, in which cases surgery is required.
Now coming to umbilical hernias. The umbilical ring is a structure which normally closes in most babies, but in some it may remain open, and through this opening there may be a bulging of abdominal contents which is known as umbilical hernia. Whenever the baby coughs or cries, the hernia tends to bulge, and this is a normal phenomenon. You don't need to panic because this is just a transmission of the pressure from the abdominal cavity into the hernia. if the hernia is asymptomatic, there is nothing that needs to be done and we just need to wait and watch. Surgery needs to be considered only if the hernia has not spontaneously closed by 4 years of age, or if there happens to be a complication like strangulation, which means a twisting of the intestines inside the hernia, or if there is an intestinal obstruction. There is a condition resembling umbilical hernia which are known as para-umbilical hernias, where there is again a bulge but not at the umbilicus. It is usually seen around the umbilicus, and in this condition we cannot wait and watch, and a surgery needs to be done for this. So that's it for this video. We hope you found this information useful. Please do check out the rest of our videos as well, and do like, share and subscribe. Do follow us on Instagram, and you can also reach out to us on Instagram if you wish to do a consultation for your baby. So we'll see you again very soon in the next video. Cheers guys.
Thank you.